Hi, Dr. Thom Bober from All Well Holistic Healthcare. Today I'd like to discuss our philosophy of healing. Most people who have an experience in the healthcare system are used to the traditional medical paradigm and often need to have an education as to how it is that we work within the holistic paradigm. So first off, it's safe to say that your brain sends messages to your body and your body sends messages back. And ideally that should be happening at 100% of the time. Oftentimes though, people incur some amount of interference. And that interference to the nervous system over a period of time can create dysfunction. Unfortunately, at that point, most people aren't even aware that the dysfunction has occurred. It is only until the dysfunction persists and creates symptoms that people are aware that something must be done. Think of human function as a spectrum. Oftentimes we think we're either sick or healthy. But in truth, we function better or poorer depending on the circumstances of our lives. So if we say that 0% function is way down here, and 100% function is way up here, we actually operate within this entire spectrum at different points in our life. When that dysfunction occurs, our level of function is lowered. When we start to approach 50% function, we express symptoms. If we ignore these symptoms, our level of function can deteriorate even more. And when we get to about 20% function, we can start to actually diagnose disease states. Now these are arbitrary numbers, but you get the idea that we operate on a level of function and that level of function changes throughout our lives. When interference between the communication system of the body occurs, function is lowered. Traditionally, when people get symptoms, they move into the traditional healthcare system, or the allopathic healthcare system, which is very focused on the symptoms. Now, this system is miraculous for a crisis care intervention, car accident, some trauma. When that occurs and you move into that system, it really is focusing on this last 20% of function. Their general first intervention would be some kind of pharmaceutical agent, which could be necessary and life-saving at the time, but in point of fact simply addresses the symptoms without really looking at the dysfunction or the interference. Our goal here is to identify the type of interference that is occurring and to reduce it to the greatest extent possible. When we look at interference, it occurs within three major categories. There can be physical interferences, slips, falls, car accidents. There can be chemical interferences. These can be toxins that we have encountered in our environment. This can be viruses or bacteria that are overtaking our immune system. And the last part are electrical imbalances that can come about because of long-term stresses in our lives. Our goal here is to use a system to evaluate the kinds of interferences that a patient presents with. And then working with the patient, either physically through chiropractic, chemically through nutrition, or helping people work through some of the stresses of their life, reduce the interference, and thus move their level of function closer and closer to 100%. I hope this gives you a better understanding of how it is that we practice here in Allwell Holistic Healthcare. We will delve deeper into each of these areas in later sessions. Thanks.